Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Welcome to this edition of Clinical Clips, an accredited continuing education activity.
Hello, my name is Sally Hodder. I'm a professor of medicine at West Virginia University, and I want to welcome you back to our fourth and final clinical clip. As everyone knows, sexually transmitted infections are epidemic in the U.S. and worldwide, and it continues unabated. Several of the studies at CROI 2024 assessed the ability of doxycycline used as post-exposure prophylaxis to prevent infection. In the first of these studies, I'll discuss the ANRS DoxyVac study. This was a French study of men who have sex with men on PrEP for greater than 6 months, and individuals who were eligible also had to have a bacterial sexually transmitted infection, or STI, in the prior 12 months before enrollment. They were randomized 2-to-1 to either doxy-PEP at 200 milligrams, 24 to 72 hours post-sex, or no PEP. Each of those arms were then again randomized 1-to-1, either to receive the gonococcal vaccine or no vaccine. This study now looks at the final data from the DoxyVac study and included 545 individuals who participated. Study results showed that there was an 83% reduction in chlamydia or syphilis and a 33% reduction in the incidence of gonorrhea. In this study, the vaccine, the gonococcal vaccine, was without a significant decrease, though the results of an ongoing phase 3 study are awaited for a definitive decision on the efficacy of the gonococcal vaccine. Importantly, in this study, they looked at tetracycline resistance for gonorrhea and chlamydia. So in this study, they looked at 78 cultures that were available for resistance testing, and they found in all of them, all the folks, tetracycline resistance, both in the non-PEP arm and the doxy-PEP arm. However, if you look at high-level tetracycline resistance in gonorrhea, it was 12.5% in the arm that did not have PEP versus threefold greater, or 35.5%, in the doxy-PEP arm. The chlamydia, however, had no tetracycline-resistant mutations. And I think that this is really a question that, we will have to look at in the future, is emergence of resistance and impact of that. A second study looking at doxy-PEP was presented by Dr. Lutenmeyer, and it was the open-label extension of the doxy-PEP study. Now, the doxy-PEP study design was randomization of men who have sex with men and transgender women living with HIV or without HIV on PrEP. And the results previously presented of that study showed a 65% reduction in bacterial STIs with 80% decreases in chlamydia and syphilis and 50% in gonorrhea. The open-label extension offered doxy-PEP to all, and roughly half of participants in either of the arms in the previous study elected to participate. If we look at the individuals who came into the open-label extension having had doxy-PEP before, their STIs remained roughly the same, with the 12% had one or more STIs in a quarter, and it was 13% in the open-label extension. However, in the group that had previously not been randomized to doxy-PEP, previous to the open-label extension, they had a 31% incidence of one or more STIs in the percent of quarters versus 17% of quarters after they got doxy-PEP. The greatest reduction was in syphilis and chlamydia. And interestingly, in the group that was a standard of care and got doxy-pep, sex partners and condomless sex increased in the open label extension. In fact, in that group, it actually doubled. And I think that just sort of shows the efficacy of this intervention. The third study was a study that was conducted in a large sexual health clinic in the Castro neighborhood of San Francisco. And all PrEP clients were eligible and offered doxy-pep. 39% of the PrEP cohort there elected to take PrEP. And what they found was that individuals who elected to take doxy-pep, their STI incidence decreased from 18.1% per quarter to 7.5%. Interestingly, those who did not elect to take the doxy-pep had a similar incidence of STIs. It was 7.5% before and 6.5% after. If you look at the specific infections, chlamydia declined by 67%, syphilis by 78%, and gonorrhea by 11%. And I think the interesting finding here was that those who were most at risk, who had the highest incidence of STIs, were in fact those that elected to take the doxy-pep, and almost a self-selection in a very appropriate way. And it's interesting that this study was really successfully implemented and conducted with interesting results in a sexual health clinic. And finally, there was an interesting poster by Victoria Chu and colleagues on the impact of doxy-pep on gut microbiome and the associated antimicrobial resistant reservoir. This study conducted DNA and RNA sequencing on a subset of 150 participants in a doxy-pep study who submitted self-collected rectal swabs. Doxy-PrEP use over the 6 months did not significantly alter the bacterial microbiome diversity or the total bacterial abundance. However, there was an associated dose-dependent increase in tetracycline-resistant gene expression, and active expression of non-tetracycline antimicrobial resistance genes was unchanged. I think that really, regarding doxy-PrEP, I think a number of questions remain. And I think that at this point, we really don't know the clinical significance of tetracycline emergence. And with increasing numbers of people using doxy-PrEP, will that significantly impact the incidence of resistant infections? I think the other issue is what populations should be offered doxy-PrEP. The studies that I sort of just discussed have all been in men who have sex with men or transgender women. There was not discussed today, but one study that was done in cis women and did not show an effect, though that was largely attributed to poor adherence. But I think that there are multiple subpopulations where doxy-PrEP may be useful that we really need to investigate. And so I think really the data, I think, are pretty clear for men who have sex with men and transgender women, but I think we need to study many, many more populations. Thank you for joining us for episode 4, and please refer to the landing page for slides and to view our previous clinical clips from CROI 2024.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.